infectious disease course. They are tetanus, diphtheria, and anthrax. First disease is tetanus. I hope my voice is clear to all of you. Isn't it?
واضح دكتور واضح.
Okay. So what about the definition of tetanus? Indeed, the definition, it is the acute onset of hypertonia or painful muscle contractions and generalized muscle spasms without other apparent medical cause. So this is important. So it is painful muscle contractions and spasms without other apparent medical cause. So this is the definition of tetanus, because there are drugs may cause painful muscle contractions and spasms. So after exclusion of other drugs and diseases, this is included in the definition of tetanus. What about the etiology of tetanus? As you know, that Clostridium tetani is anaerobic, is responsible for this disease. It is anaerobic gram-positive spore-forming rods. So these are the group of bacteria that are transmitted by spore formation. So it is a gram-positive bacteria and are spore-forming. Usually the spores are resistant to boiling and many disinfectants, and why this disease is transmitted easily when there is contamination by soil. So the spores of these bacteria usually resist boiling and many disinfectants, including Dettol, bleach. These spores are resistant, okay? And the spores are generally get entry into the body through the abrasions or wounds, commonly wounds. And sometimes the abrasions are so minimal or trivial that the patient will not report any previous trauma or wound. So sometimes any minor abrasions, these spores may get entry into the body. And as you know, the spores of Clostridium tetani are ubiquitous through the sand and soil and the environment. So any wound contamination with sand may get infected with these spores. And the Clostridium is usually the inhabitant of the bowel of many animals. So these are the normal flora of bowels of many animals. And so the stool, when get contaminated with the soil, and the patient, for example, walk on bare hand or on bare feet, and get contaminated by sand for trauma or any thorn from the wood, these spores may get transmitted to the skin. So once in a suitable anaerobic environment, get in the wound, for example, deep-seated infection or wound, the organisms grow because it is anaerobic. So any superficial wound unlikely to be contaminated, but deep wound, especially if the patient has got bandage over the wound, will create an anaerobic environment or atmosphere. It will encourage the cultivation of these spores and get generated into the mature bacteria. And this, after growth of these bacteria and multiplication, it will release an toxin. It's called tetanospasmin. So it is an exotoxin, not attached to the cell membrane of this bacteria. And the generation of this toxin will be responsible for the clinical manifestation. So cultivation of the spore, then generation of the bacteria will multiply and release this toxin. The toxin will be transmitted into the exons, down back into the nervous system, and will be responsible for the manifestation of this disease. Okay, واضح? Sorry for the sound. Okay, sorry, I have some problem in my house. Sorry for this interruption. Okay, again back. So I hope the pathophysiology of tetanus will be clear to you upon this after finishing this slide. واضح طلاب؟ عندكم سؤال لحد الآن بالنسبة لل pathophysiology of tetanus؟
واضح دكتور واضح.
Okay. Indeed, superficial abrasions to the limbs هي صراحة are the commonest infection sites in adults. And عادة any minor abrasion, trivial trauma, that will create a abrasion in the skin and get into the disease. When there is deep infections and deep wound and deep infection in the wound, there will be more severe disease. Why? شو تتوقعون ليش deeper infections will result in more severe disease?
دكتور يوصل للميجر نيرف توكسين.
Ultimately, the toxins will be reached to the sites of the neurons that are available at the site of a trauma. But why deep infection? وممكن superficial هم يسوي disease. But why the deeper infections the patient will have more severe disease. يعني بلقى المريض عنده deep wound, for example, shell injury, traumatic amputation.
إنه راح يعبر البارير مال السكن.
So it will cross the barrier of what?
البارير مال السكن يعبر.
No, this is the explanation. Because deeper infection, why? Deeper infection will result in low oxygen environment. مو كل ما الwound يكون deep راح يكون decrease the exposure to atmospheric oxygen. This organism need anaerobic media. So when there is deep infections, it will create more favorable anaerobic media. So there will be more multiplication of bacteria and as a consequence, more amount of toxin generation. احنا الديزيز يعتمد على toxin generation. The higher the amount of toxin, the more the severe the clinical manifestation. واضح؟ The deep infection is usually associated with more severe disease and poor outcome. هاي الفكرة من عندها. واضح طلاب؟ Why deep infection get more severe disease? As a result of more toxin generation because it favor anaerobic environment. What about the epidemiology? How disease is common among the age group? Persons more than 60 years of age are at increased risk of tetanus. Why? Because the antibody level decrease over time. As you know, the DTaP vaccine is usually given as a part of a vaccine schedule in infancy and childhood and preschool. But unfortunately, as the person age, the usual protective antibodies will be decreased. So the patient normal person needs booster vaccines. So if he didn't take vaccinations at all or didn't receive booster vaccine, the antibodies will be decreased. So the persons at such age will be vulnerable to tetanus. This is very important. When you get a patient more than 60 presented with painful muscle contractions, even if he didn't report any previous trauma or wound, you have to take into account tetanus as a differential diagnosis if there are no other explanations of this painful muscle contractions. What about the pathogenesis? After multiplication and release of the toxin, it will be absorbed into the nervous system and undergoes retrograde transport into the central nervous system and thus produce its clinical effects there. So after toxin generations, it will be uptake by the neurons into the axons and back down to the central nervous system, reach the cells, and here it will be responsible for the clinical effects. So there will be retrograde transport. لذلك تتوقعون which is يعني إذا واحد عنده wound مثلا بالlower limb وواحد عنده wound بالupper limb. How fast is the clinical manifestations of the patient had contaminated wound in the upper limb versus in the lower limb? Who will be at a faster rate to develop the clinical manifestation of the disease? Which is earlier? The upper limb wound or the lower limb wound? Yes, why? المريض عنده upper limb wound versus lower. Why did he have? Pardon, I didn't hear your voice, please. Could you repeat your answer? Why? The upper limb wound has more
because
likely
هو
to develop.
الأبر حيكون أقرب
Yes, the
المسافة
axons, the distance from the side of wound till the central nervous system will be shorter. Similarly, إذا عند واحد مريض contaminated facial wound, the manifestation will be very rapid. واضح? So the shorter the distance from the central nervous system, the earlier manifestation of the disease. So how we approach to the patient? The clinical manifestations of tetanus occur only after tetanus toxin has reached the presynaptic inhibitory nerves. Unfortunately, يعني المريض من يجينا هو the disease will be established. The toxin will be bound to the presynaptic inhibitory nerves in the spinal cord and in the brain. Okay? And the toxin already released. احنا ما راح نشوف المريض مرحلة المultiplications والtoxin generation. Usually, the patient will complain of muscle contractions and spasms that usually occur only after tetanus has reached the presynaptic inhibitory nerves. Once these effects become apparent, there may be little that can be done to affect the disease progression. Why? Because the already toxin has bound to the presynaptic inhibitory nerves and reached the central nervous system. واضح؟ فاحنا هنا بالمانجمنت لازم prevention and education of the people about the disease prevention, how toxin will be prevented. Okay? Sorry. Why? Because already toxin has bound. Once there is binding by the toxin by the neurons, طبعا ما راح نقدر نوخر هاي until there will be new neuron generations. What about the clinical manifestations of tetanus? There are three forms, main forms of tetanus. Other forms but are less common are the neonatal المذكورة هنا, and the generalized, which is the most common type, cephalic, and local tetanus. Yeah. Okay. There will be other, يمكن تاخذوا بالpediatrics, will نسميه neonatal tetanus, occurs in the neonatal period after contamination of the umbilical cord with the sand or soil. Okay. So this picture demonstrates the pathophysiology and some of the clinical manifestations. So there is a minor wound, get contaminated with soil. There will be retrograde exon transport of the toxins into the central nervous system, including the spinal cord, the presynaptic inhibitory neurons, and the brain. This is the picture demonstrate the عادة اللي يشوفونه the appearance of the bacteria under electron microscopy. تشبه الريكتس مو. This is the gram and this is the toluene. This is the gram-positive bacteria. After that, after reach through the bloodstream or the retrograde transport of the toxin, that will cause the major manifestations. One of the commonest manifestations is the spasm of the jaw. تشوفون شلون contractions of the muscles and the platysma. واضحة يمكن contractions very clear. This is very painful. Neck muscles also. اللوك jaw شو نسميه عادة trismus. look jaw شو نسميه جزمة يعني. Patient could not open or even close his jaw. يبقى at certain times slightly opened ما يقدر لا يفتحه ولا يسده. This is very painful. نسميه trismus look jaw. One of the common manifestation. يعني خاف يجيكم مريض الطوارئ يقول لي دكتورة مثلا أو دكتورة أنا ما أقدر أسد حلقي أو ما أقدر أفتحها. So you should keep the differential diagnosis of tetanus. Rhizus sardonicus. This is نسميها يعني ضحكة الشيطان. This is the unusual smile. نسميها Rhizus sardonicus. Rhizus sardonicus. Dysphagia, which one of the earliest symptoms of tetanus. In addition to the lockjaw, ما يقدر بعد يبلع. Even his saliva, he could not swallow his saliva. So the patient at risk of, aspiration. As the disease progresses, other muscles will be involved, including the upper limb, the شوفون شلون fully extended, and there will be نسميه arcing of the back. يعني مريض بعد his back could not reach the bed. Only his head and شوفون شلون hyperextension of the neck and of the pelvic, of the hip, hyperextension of the hip and the neck muscles. There will be arcing of the back with the advanced disease. نسميه هذا البوستشر شو نسميه؟ oposthotonous. A postotonic posture with the arm extended, neck hyperextended, and the pelvic also, psoas and muscle will be hyperextended. This is very painful. This is also severe muscle spasm. تشوفوا المسل شلون contracted, sternocleidomastoids, the facial muscles, and it is very painful. The most common manifestation is trismus, locked jaw. The jaw will be locked, could not be opened. Muscle pain and stiffness, back pain. Why? Due to muscle contractions and dysphagia, or difficulty in swallowing. Commonly, the laryngeal muscles are also involved early or even in isolation. مرات ما شنو تتوقع شنو manifestation if the laryngeal muscles are involved? What are the manifestations if the laryngeal muscles are involved? تتوقع what are the clinical presentation?
دكتور يختنق.
Disney.
يعني airway obstruction.
Yes, very good. The patient will complain of suffocation and shortness of breath despite normal oxygen. واحد يجيك مختنق وال SpO2 مالته normal. مو معناه the patient has no respiratory disease. So because of the involvement of the laryngeal muscles, then بعد ممكن dyspnea, ممكن sensation of suffocation, بعد اكو other symptoms.
Hoarseness.
نعم العفو.
Hoarseness in voice.
Yes, very good. Hoarseness of voice or even dysphonia. Dysphonia sound. You could not generate sound during talking. Okay. So what do you expect? What is the most common cause of death of tetanus? This is a homework. Okay, you have to search about what is the commonest cause of death in tetanus. واضح? Okay. In addition to involvement of the motor muscles, يعني قلنا المريض will complain of painful contractions. شفنا احنا كلها skeletal muscles, right? Neck, back, upper limb, lower limb. What قلنا the commonest manifestation of tetanus هو شنو؟ locked jaw or trismus. The central nervous system will be also affected by the tetanus. So how would you expect the manifestation if there is disturbance in the function of the autonomic nervous system? What are the clinical manifestation of the autonomic nervous system disturbance?
Dryness.
نعم.
Dryness.
Of what dryness?
ماكو sweating يعني
Maybe.
مكان involved.
زين. Good. بعد.
دكتور vasodilatation ماكو بعد vasoconstriction بالالفا receptor.
It will be flushing of the skin. Yes, right. بعد. So the central nervous system is responsible for multiple physiological functions in the body. In addition to the blood vessels, بعد autonomic control of what? There are major organs will be affected by the autonomic central nervous system disturbance as a result of toxin of the presynaptic neurons in the central nervous system. So there will be disturbance in the sympathetic and parasympathetic, right? One is sympathetic or parasympathetic. So if they are affected, so the major organ may be affected, the heart, right? There will be tachycardia, there will be arrhythmia, and disturbance. ممكن يصير المريض pulse rate at all of a sudden 160 and sometimes 40 beat per minute. Tachycardia, bradycardia, واضح? There may be labile blood pressure readings. Sometimes hypertension, يعني ممكن المريض يجينا 200 over 180, ممكن المريض يصير شنو 80 over 40. Hypertension, hypotension, واضح? There may be gastroparesis, there may be constipation. So these are the manifestation of the autonomic nervous system disturbance, and it is usually apparent and after during the second week. After the first week, usually it will be apparent. So it is maximum during the second week of severe tetanus. The patient at this time should be transferred to the intensive care unit for the heart rate monitoring, blood pressure monitoring, etc. واضح؟ بس لحد الآن نعم manifestation واضحة بالنسبة للتتنس. عندنا skeletal muscle وعندنا شنو autonomic.
دكتور بالاوتونيك ديستربنس هم يصير عنده برونكو كونستركشن؟
نعم.
بالاوتونوميك ديستربنس هم يصير عنده برونكو كونستركشن؟
uncommon عادة، يعني احنا البرونكيال وول يعني unlikely to be affected عادة، بس احنا خلوا بالكم ممكن المريض يصير عنده aspiration، مو احنا قلنا dysphagia صح ولا لا؟ Dysphagia, the patient will undergo infections of the lung as a result of poor swallowing efforts. واضح؟
زين دكتور، انت بالاوتونوميك ديستربنس قلت انه ممكن يصير عنده تكارديا او براديكارديا او هايبرتنشن او هايبوتنشن، يعني بشنو على شنو يعتمد المرض حتى يصير تكيكارديا او براديكارديا؟
Oh, there will be autonomic disturbance. Which system will be affected predominantly, either the sympathetic or parasympathetic? واضح? So there may be excess parasympathetic excess or there may be excess sympathetic excess. يعني تعتمد على التوكسين. هو ماكو شيء واضح، بس هو عادة البيشنت will be مرة تلقيه تكيكارديا، مرة تلقيه براديكارديا، مرة هايبر، مرة هايبو.
يعني حسب
So it depends which system predominantly affected.
حسب اذا انصاب السمباثيك او الباراسمباثيك.
نعم.
شكرا دكتور.
نعم. بس احنا خلوا بالكم، احنا من يصير المريض عنده excessive parasympathetic stimulation، يعني عادة ايش نتوقع باللنج اذا واحد عنده excess parasympathetic stimulation؟ يعني if you can conclude from the physiology of the central nervous system، اذا واحد عنده excess parasympathetic in the lung، يعني عادة اللنج هو trachea عادة هي affected، عادة بيها sympathetic and parasympathetic، بس اللنج by itself not، ما عندها sympathetic and parasympathetic يعني supply. بس التراك yes there will be يعني autonomic nervous system supply. وش يصير عادة؟ شو نتوقع عند إذا واحد صار عنده excess parasympathetic stimulation in the trachea؟
دكتور contraction.
دكتور بالتراكية بروتون كونتراكشن.
yes اوكي bronchospasm واضح جيد. بعد والمريض عادة ايش يشكو؟ excessive secretions there will be bronchoria. راح المريض يطلع عنده salivation excess and شنو؟ bronchoria excessive secretions from the trachea، excessive frothy secretion from the trachea. واضح؟ فالمريض راح يشكو من excessive secretions. هاي secretions ممكن شو يسوي له؟ respiratory failure. المريض راح يصير عنده aspiration hypoxemia، ممكن يصير ARDS as a result of excessive bronchoria. واضح؟ وقلنا البقيه ممكن sweating، يعني gastrointestinal stasis ممكن يصير عنده مو as a result of the autonomic nervous system of the GI tract will be involved by this disease. هاي المشكله. autonomic nervous system is very important part of death، يعني واحده من واحده من common causes of death, but it is not the commonest, especially in the يعني second week عاده هو more common cause، بس بالfirst week لا there is another cause. هذا الهومورك. اوكي واضح هسه؟ which organs are affected؟ the skeletal muscle كل انواعها and the autonomic nervous system اللي هي responsible. لذلك الskeletal والautonomic will be expected to be responsible for the manifestations. واضح طلاب لحد الان؟ So the diagnosis is clinical. The diagnosis of tetanus is clinical after exclusion of other causes by history. The culture and serum tetanus immunoglobulin will be supplementary if we are in doubt about the manifestation. But once you have suspected tetanus, you should treat it immediately. Culture, because it takes many days to the result of the bacteria. Serum tetanus immunoglobulin is always not available in the hospitals. مو دائما موجود يعني. ما ننتظر السيرم tetanus immunoglobulin. Okay. What are the differential diagnoses of this appearance اللي قلنا obestotonus or the lockjaw strychnine poisoning? It is a substance used for killing of the stray dogs, inadvertently sometimes taken by children or even suicide. So strychnine poisoning is another differential diagnosis, but it usually has no autonomic nervous system component. Dystonic reactions, dystonia, that's dystonic related. لو واحد مثل ما اخذ metoclopramide may present with such presentation. Lockjaw, which are medications are used? If there are, may present with started neuroleptic drugs, so may cause such a presentation, dystonic reactions. هاي مهمة طبعا. إذا المريض نعرفه history of schizophrenia مثلا ياخذ drugs اللي نسميه neuroleptic drugs may cause excess cholinergic stimulation, dystonic reactions very important, and oropharyngeal infection. Oropharyngeal, for example, dental abscess may cause شنو trismus عادة. مريض هم يجيكم ما يقدر يفتح حلقة. He could not open his mouth. So oropharyngeal infection also it will be apparent. يعني fever, infection, tenderness on the site of examination. It will be apparent from the histology examination. So keep in your mind the differential diagnosis of tetanus.
دكتور
Yes.
العفو بس الصوت كان يقطع تقدر تعيدها مال dystonic reaction؟
Dystonic reactions is usually عادة a side effect of multiple drugs. The most important one is the most important prodrug responsible for this reaction is metoclopramide. As you know, it is an antiemetic commonly used as an antiemetic medication. يعني المريض ممكن يدخل الطوارئ complain of, for example, diarrhea, vomiting. You prescribe a metoclopramide. After a few minutes, the patient will complain of severe muscle contractions of the neck muscles, especially sternocleidomastoid, the mouth, and will also present with lockjaw. It will be apparent. It is an acute reaction. ماكو واحد عنده dystonic reactions chronic. It is an acute reaction. أو ممكن هو ماخذ من مركز صحي أو صيدلاني مثلا طاهية مثلا يعني due to nausea and vomiting as a symptomatic treatment and present to the emergency department with lockjaw and painful muscle contractions. So one of the different, it may be tetanus, but after you take the history and you يقولوا لك مثلا دكتور شو بناخذ هذا الدواء صار عندها هاي الحالة فمعناته drug related. So it is usually easily excluded by asking about the drug history. Other drugs, مثلا neuroleptic drugs, مثلا a patient with known to have schizophrenia and prescribed a neuroleptic drug or psychotropic drugs that may cause similar reactions, similar dystonic reactions, and oropharyngeal infections. What about the treatment? The principles of treatment of tetanus? We have the entry wound should be cleaned and debrided. Why? Because if the bacteria is still alive, it will still generate the toxin and the patient is unlikely to recover. So any apparent wound should be cleaned and sterilized and debrided. So it will cut down the vicious circles of multiplication of bacteria and toxin release. So you should cut down the circle. In addition, if there is any viable bacteria, it should be killed by the antibacterial therapy. واضح? Why you give antitoxin? Because there may be still unbound toxin to the neurons. So you should give antitoxin to neutralize the unbound toxin in the blood. Because when the toxin reach the nervous system, there will be little role to unbound this toxin because it's already bound. But if there is still either the bloodstream or the neurons, if it is transmitted by the neurons, nothing will be done to treat this toxin. But if there is still toxin in the blood, you can unbound this toxin by giving the نسميه هذا لقاح ضد القزاز إذا سامعين به بالناس تداوله. إذا واحد عنده مثلا ينجرح ويجي للمركز الصحي أو طوارئ يقول له دكتور أريد أبرة مع القزاز. This is the principle of antitoxin. It will bound the unbound toxin, the free toxin in the blood, and will help prevent the disease if it is especially given early in the disease. يعني مو واحد صار له 3 أيام 4 احنا قلنا once the manifestation will be apparent, there will be no drug can unbound the already bound toxin, but the free toxin can be neutralized by giving the antitoxin. In addition to supportive therapy to the cardiovascular system, respiratory system. Okay. طبعا patient with tetanus will be very sensitive to the light, to the sound. So it should be nursed in the calm, dark environment. ممكن تجي when you have a tour or a clinical examination of tetanus, you should be very gentle and you should not generate sound. Okay, and the examination should be minimum up to the point because any sound ممكن when there will be triggering of the muscle contraction of the واضح بالنسبة how the patient should be managed of tetanus. طبعا احنا admission to the intensive care unit is mandatory especially after the first week. يعني مو نخلي المرض بنص الرجهة وهذا يصيح وذاك يعيط وهذا pain عنده. There will be triggering of the muscle contraction, so it should be nursed in the calm environment. Okay. حتى هذا monitoring of the ICU يعني تعرفون there are multiple sounds in the ICU patient. واضح؟ So this sound may trigger muscle contractions. So it needs special handling for patient with tetanus.
دكتور
Yes?
ترى صوتك ده يقطع.
ظهر اكو problem in the internet يعني this is out of my control. كلش مو واضح يعني الصوت؟
يعني دكتور هواي نقط مهمة من تحكي يروح الصوت يعني
نعم. اوكي ممكن اذا هاي المحاضرة اسجلها واعطيكم اياها يعني اذا تشوفون الصوت بي بروبلم.
والله دكتور صار اخر شيء يعني ما اسمع له.
هواي مصاحب. تريدون اسجل المحاضرة صوتية وادز لكم اياها اذا ما واضح؟ لان يعني مشكلة الانترنت اليوم ما اعرف منطقتنا بيها مشكلة يعني حاجة تجي يعني مو على الواي فاي. يعني ما عندي صراحة معتمد على 3G in the streaming of this lecture. فإذا تحبون يعني أسجلها كمحاضرة صوتية وأنزل لكم إياها على جوجل كلاس روم إذا الصوت فد مرة مو واضح يعني.
لا دكتور هسه زين الصوت واضح.
نعم أوكي إذا الصوت واضح أوكي. So the prognosis of patient with this is very important. Time of onset of the symptoms. يعني المريض إذا عنده مثلا wound in the thigh أوكي قال لك أنا الجرح مالتي دي انجرحت قبل مثلا أسبوع وهسه بدت المانفستيشن بدأ يصير عندي pain و contractions ولوك جو. كل مريض ثاني لا صار له يومين وبدأ عنده التريزماس. So the earlier the manifestation the more poor prognosis. معناها شنو؟ There will be more toxin generation. So the rapidity of time of onset will affect the outcome of the disease because the patient received high dose of tetanus plasmine الحالة. So rapid development of tetanus is associated with more severe disease and rapid outcome. لهذا المريض صار عنده wound بالثاي ورا يومين ثلاثة قال لك شو أنا ما أقدر شن جسمي كله ما أقدر أفتح. هذا يسموه rapid onset of disease. So rapid onset associated with poor prognosis. Why? Because large volume of tetanus plasmine or tetanus exotoxin generated. عكس المريض صار له أسبوع أو 10 أيام وجه هسه. واضح؟ وبالتالي this will reflect the incubation period. صوتي واضح هسه لحد الآن؟
اي دكتور.
زين. So the shorter the incubation period the worse the outcome. بينما المريض ان هذا الاسبوع وهذا العشرة ايام لا تختلف. لذلك rapid onset of generalized tetanus poor prognosis. The short the incubation period the poor the prognosis. Okay. What of the prevention? As you know, every patient will get wound treated with soil. Should have a good wound care plus immunization. So if you get a patient قال لك أنا انجرحت contaminated with soil, you should give him advice about wound care, proper cleaning of the wound, and immunization. إذا هو ما ماخذ vaccine by DTaP. لأن نعرف إحنا Diphtheria, Tetanus, Cellular Pertussis vaccine. vaccinations يمكن لو بعدكم vaccination أخذتوها؟
أخذنا.
ما أخذ vaccination. إن شاء الله يعني أقدر محاضراتكم الكوريكولا. أنا الفاكسينز ناخذها بالبيدياتريك صراحة. الكورس ناخذ الفل فاكسينيشن. عادة الديفتيريا عادة نسميه الواحد الديفتيريا وأسيلولار بيرتوسس the disease pertussis إذا سمع عني pertussis قلتوا بعدكم and tetanus. So 3 in 1, 3 vaccines in one combination in one يعني in one shot the acellular pertussis اللي هو نسميه احنا in Arabic سعال الديكي acellular pertussis tetanus اللي هو القزاز and diphtheria الخناق باللغة العربية. And then the 3 vaccines killed vaccine طبعا given in one shot عادة بالneonatal period. There was a schedule for this vaccination and there will be booster dose in the preschool age and then every 10 to 15 years you receive this booster vaccine. لذلك المريض يجي عنده what about your vaccination? Did you receive a booster dose or not? إذا ما أخذ booster you should give booster dose. Okay. If you didn't vaccinate at all you should receive vaccination يعني بعد ما تضيل schedule of the vaccinations. يعني حول المركز الصحي هياخذ اللقاح الكامل دي تاب نسميه دي تاب دي اللي هو مال ديفتيريا تاب tetanus. This is tetanus. This is diphtheria. AP acellular pertussis. Acellular pertussis. This is also a killed vaccine. واضح؟ لقاح الثلاثي نسميه. Okay. طبعا to neutralize the unbound toxin you have to give اللي هو اللقاح هذا موجود عاديا هم ما يسموه لقاح بس it's not لقاح. This is immunoglobulin. This is anti-tetanus toxin immunoglobulin to neutralize the unbound toxin. Anti-tetanus immunoglobulin موجود عادة بالمستشفى مالتنا يجون دول عندهم تروما خصوصا traumatic wound, RTA, road traffic accident عندهم wound especially if it is grossly contaminated with soil. موجود عندنا حاليا هو نسميه human tetanus immunoglobulin. Okay. Human tetanus immunoglobulin. This is available in our hospital. نعطيه عادة intramuscular. As a single intramuscular dose. عادة مرات نقسمها يعني لو مريض عنده wound around the thigh. Okay. ممكن نعطي injection around the thigh, especially around the wound to bound the unbound toxin. والثاني in the other buttock مثلا نكون نعطيه اياه. Okay, so as to reach the circulation and neutralize any toxins. طبعا supportive treatment هي early يعني supportive ventilation, securing the airway. ممكن المريض يحتاج ventilation. زين تعرفون شنو مصر relaxant؟ إذا المريض قال لك الريلاتيف مالتي هذا المريض يوجعه كل ساعة عنده contractions. يعني شنو التريتمنت يعني المسل contractions. If you can memorize it from the pharmacology, do you know any other muscle? Do you know يعني any muscle relaxant? إذا صوتي واضح for the of muscle relaxant.
دكتور جماعة السكسنة كلهم؟
يس بس هذا اذا نعطيه اياه المريض راح يصير باراليسيس يقدر يتنفس اصلا يعني شويه على كيفك
إيه؟
واحده
يعني هو البروتوتايب بس
نعم.
البقية
يس يعني ممكن فشي سمبل يعني يسوي مصر ريلاكسيشن اسهل شويه.
دكتور جماعة البنزوديازيبام
Yes, Valium very important. يعني diazepam is a good drug for muscle relaxation. Benzodiazepine very important. ومريض عادة يحتاج heavy sedations حتى يعني diazepam من نعطيه muscle relaxation يحتاج large doses مو هذه usual doses for sedation. Okay. لذلك الspasm should be controlled by sedation and benzodiazepine, heavy sedation and benzodiazepine. Okay. مرات نعطي الكلوربرومازين.
دكتور
نعم.
دكتور انت قلت انه تيتانوس يسوي لنا برونكوس بازم مو هيك دكتور؟
Tetanus yes.
دكتور فهذا السبب ممكن انه يقل الاكسجين سبلاي للتشو وبهاي الحاله هو المسبب للديث.
ما فهمت سؤالك شنو تقصد؟ طبعا هو hypoxemia and respiratory failure is one of the important causes of death in patients with tetanus. Yes طبعا. Sodium aspiration, pneumonia. Yes. So individuals sustaining tetanus-prone wounds should be immunized. وقت نعطي vaccinated if there is their vaccination status is incomplete or not. قال لك أنا ما أدري ما أعرف واحد عمره 60 سنة ما تعرف vaccinated or not, so should be immunized at this time إذا unknown. Or if their last booster dose was given more than 10 years. Now immunization is very important. ليش؟ لأن why أكثر من 10 years? Because the waning of the antibodies against tetanus. Okay. فبالإضافة لنعطي anti tetanus immunoglobulin to bound the toxin, you should be immunized after recovery. نعطي immunization. So when the vaccination status is incomplete or of the last booster dose more than 10 years. So you have a homework here also in addition to that. What is the preferred antibiotic used for the treatment of tetanus? What are the complications of tetanus? And what are the poor prognostic features of tetanus? 1, 2, 3. These are very important questions in your future clinical practice career about tetanus. It is a common disease in Iraq. Keep in your mind, and it is usually a preventable cause of death. So the preferred antibiotic, complications, poor prognostic features. Some of them already I elaborated during the lecture. واضح طلاب لحد الآن بالنسبة لل tetanus؟ Okay. The next disease is diphtheria أو الخناق باللغة العربية. Diphtheria. I know you have already come across this disease in bacteriology, right?
إيه دكتور.
Okay. So the definition of diphtheria. Diphtheria is a nasopharyngeal and skin infection caused by the microorganism Corynebacterium diphtheriae. As you know, the Corynebacterium diphtheriae is a gram-positive bacillus, and the disease is transmitted. لكن شلون قلنا transmission in the body by the contaminated soil in the wound or the abrasions. This is usually an aerosol route. So aerosol route, droplets. And the incubation period for the respiratory defect around 2 to 5 days after the exposure to the index cave. صوتي واضح؟ وما يقطع طلاب؟
نعم.
واضح. Okay. So the incubation period is 2 to 5 days, and the disease is most common during winter months, where the bacteria are active. What about the pathogenesis of diphtheria? There will be initially white and firm adherent coat on the pharyngeal area. As the disease progresses, there will be pseudomembranes turn gray or even green or black as a pseudomembrane. So a membrane over the mucous membrane. Why it is called pseudomembrane? So it is not usual the mucous membrane of the throat. This is the secondary membrane over the throat due to the death or necrosis of the cells, shedding of the cells. So initially it will be gray. As the disease progresses, may give green or black as the death or shedding of the cells. This is with advanced diphtheria. Mucosal ulcers are accompanied by edema as a result of inflammations. There will be ulcerations, edema, hyperemia, vascular congestions of the submucosal space.
دكتور ما فهمت ليش يسموها سيدا ممبرين؟ لأن مو نفس الميكوزا مال.
Yes, it is not the actual mucous membrane of the, for example, the throat. Why? Because as the infection kills the cells, there will be shedding of the cells, and so the necrotic cells will be accumulated over the original mucous membrane. So why we call them mucous membrane? So واضح? It's not usual the membrane that will be affected, the usual mucous membrane. This is due to excessive shedding of the dead cells. Excessive shedding of dead cells. واضح هنا؟ So after the pathogenesis, after the respiratory tract, for example, in the nose, there will be establishment in the nasopharyngeal area because it is a nasopharyngeal infection, multiplications inside the cells in the nasopharyngeal area, and followed by death of these cells and shedding. Excessive shedding will result in pseudomembrane formation. This is very characteristic of diphtheria. This membrane is usually green or gray in color. As the disease progresses, there will be multiple mucosal ulcers and black necrosis of this membrane. So how to approach to a patient presented with وعادة presentation sore throat. So this disease should be considered when a patient has severe pharyngitis. So it is not usual form of pharyngitis. And most of the patient will complain of simple sore throat and resolve. Patient with diphtheria usually have very severe disease. The patient is very toxic, very severe sore throat, and even cannot swallow. Even dysphagia may cause. And the presence of a pharyngeal pseudomembrane or an extensive exudate. Sorry. So one you should consider diphtheria. When a patient, number one, have severe pharyngitis, or on examination the patient have pharyngeal pseudomembrane or very extensive exudate over the pharyngeal space, you should suspect diphtheria. So what are the leading causes of pharyngitis? What are the leading causes of pharyngitis? This is a homework. This is very common presentation. What are the leading causes of pharyngitis? And واحد عنده sore throat. So what are the leading causes of pharyngitis?
دكتور
Yes.
دكتور يعني ليش إن هذا الدفتيريا سوفرنجايتس لو شنو يعني السبب الشائع للفرنجايتس؟
What are the causes of sore throat؟ مريض جاك عنده sore throat. شنو بالك؟ What are the causes؟ هاي أردكم تصلوا لي إياها ودزوا لي إياها.
Streptococcus pyogenes there.
Yes, there are many causes. واضح؟ There are many causes of pharyngitis. I need you to classify them according to the etiology. And this etiology causes. What are the causes? So what about the clinical manifestation of tetanus? The most important one is sore throat. It's very common initial symptom of diphtheria. Fever, very common, and adherent tonsillar pseudomembrane. So this is the triad of diphtheria. Severe sore throat, toxicity, fever, malaise, fatigue, and extensive tonsillar membranes or pseudomembranes. شوفون هسه هذا واضح؟ هذا اذا اخلي هنا تنك ديبرسر واحكه راح يروح هذا كله يختفي طبعا يصير bleeding طبعا due to excessive shedding of cells. يعني عادة من نشوف هيك مريض present with especially in adolescent because the disease in young age group عادة very يعني uncommon عادة شوية بالold age ممكن يصير بس عادة هو بالpediatric to adolescent age. Patient severe sore throat, you could not swallow. When you examine the mouth and you found such membrane, you should suspect diphtheria. This is another picture of diphtheria. تشوفون هذا الاكستنسيف هذا هنا لونه جراي صاير على جراي هنا وايت ممبرين واكستنسيف. And عادة it may occur in مثلا for example streptococcal infection but it's unusual. يعني من نشوف هيجي you should take مثلا swab for culture and start empirical treatment. تشوفون هسه هذا شلون bull neck نسميها bull neck. تشوفون شلون السوالينج صاير in this space especially the age مالته young so you should suspect diphtheria. واضح طلاب؟ هاي نسميها bull neck which is very characteristic of diphtheria. So the diphtheria, the diphtheritic pseudomembrane is gray or whitish and sharply demarcated. شوفون شلون sharply demarcated. Very واضحة clear white مرتبة. So the diphtheritic pseudomembrane is gray or whitish and sharply demarcated. And these are tightly adherent to the underlying tissues. And if we rub them with the tongue depressor, it will cause bleeding to the underlying normal mucosa. This is the manifestation of skin diphtheria. يشوفون شلون punched out ulcer in the skin. احنا قلنا اكو two forms. احنا الموست common هو الفارنجيال diphtheria. This is the cutaneous type of diphtheria. So punched out, inhaled ulcer. اكو طلاب سؤال؟ صوتي واضح طلاب؟
واضح دكتور واضح.
اوكي. ماكو سؤال لحد الان بالنسبه لل manifestation of diphtheria؟
دكتور هاي البولنيك شنو سببها؟
عفوا؟
بولنيك شنو سببها؟
بولنيك شو تتوقعين شنو سبب هذا؟ excessive
swelling
no
of the
exudations and swelling of the lymph node نعم شنو هالاريا هاي مو اكو lymph node؟ okay. There will be enlargement of the lymph node and even necrosis and abscess formation here as a result of oxidation of the lymph node. احنا عادة هنا شو نسميها الليمف نود؟ يا الليمف نود هنا موجودة jugulo digastric او نسميها tonsillar lymph node. هي اصلا lymphatic drainage of the tonsil will be at the angle of the jaw. واضح طلاب؟ بس بالنسبة للريسبيراتوري diphtheria and cutaneous diphtheria عندنا هنا two main forms، عندنا respiratory وعندنا cutaneous. هاي characteristic مال الكوتينيوس اللي نسميها punched out ulcer.
دكتور
Yes.
دكتور بس بالنسبة للبولنيك من نسوي لها اكزامينيشن نسوي مثلا على بس الجهة لو من يعني ما نوصلها لو شلون من اسوي جنرال
طبعا you have to
اكزامينيشن
start with the
للليمف
normal. You have to start with the normal side and we be very cautious because this area is very tender عادة. يعني you should examine it very gently يعني. So it is tender or not, okay? So you should be very gentle in the examinations. So this manifestation is high in عادة due to شنو very massive enlargement of the tonsils and enlargement of the edema and the swelling of the high area. كلها تصير high swollen. Lymph node enlargement. In addition to that, enlargement of the result from the edema of the submandibular and paratracheal region. حتى عادة المريض ممكن يصير عنده stridor as a result of airway obstruction and malodorous smell. Okay.
دكتور شنو فرقها عن البوليمورفيك ادينوما؟
Polymorphic adenoma. عادة you mean the parotid swelling. This is not parotid.
مو هي بنفس المنطقة هم swelling وتندر.
Yes, you have to know the earlobe. If there is a rise in the earlobe, this is parotid. If there is no rise in the earlobe, عادة high lymph node or other causes. Now, the parotid gland is intact. The area is due to edema and massive enlargement of the tonsils and the associated lymph node. حتى هنا السبمانديبولار تشوفوه شلون enlarged؟ هنا abnormal هنا مو شوف extension of the edema and the swelling as a result of severe inflammation. So this may be due to ممكن other differential يعني هذا مو بوليومورفيك عندنا اخف. انت المور كمان هو شنو؟ mumps مو mumps. يصير pain swallowing in the area. بس عادة patient with mumps usually not complain of sore throat يعني after establishment of the parotid swelling. هنا راح تفتح الماوث مالته حتشوف extensive pseudomembrane. يعني عادة بنشوف هيك please examine the mouth. If you see extensive pseudomembranes or even membranes, you should take into account the presence of diphtheria. مريض عنده mumps عادة ما عنده extensive pseudomembranes. Okay, ما عنده sore throat, enlargement وهاي الأمور. Okay, but simply you can notice the earlobe. If it is deviated away, this is parotid swelling. If it is not, this is usually due to lymph node or other causes. Okay, what are the possible complications of diphtheria? So these are the possible complications of diphtheria as a result of toxin release and formation of pseudomembrane. So there will be airway obstruction as a result of edema, inflammation, and obstruction of the upper airways. So the patient may present with stridor as a result of upper theory. This is usually will be released into the circulation and will cause the polyneuropathy in addition to myocarditis. So these are the toxins mediated manifestation, polyneuropathy and myocarditis, but these are the usual as a result of multiplication and necrosis of the cells. What about the diagnosis? Is also as a clinical, depend on your examination and high index of suspicion in winter month, especially if the patient is unvaccinated. But for the epidemiological implication, it needs either cultivation of the host bacteria from the nasopharyngeal swab, okay, cultivation of the Corynebacterium diphtheria, or the production of toxins, toxigenic Corynebacterium ulcerans. So you have to demonstration that the Corynebacterium release the toxin. لكن احنا بحد الدايجنوستس هو clinical. So the respiratory diphtheria should be considered in any patient presented with sore throat, severe pharyngeal exudation, and fever. And especially if the patient become hoarseness and the stridor, and even may cause palatal paralysis. So the diagnosis is clinical: severe sore throat, severe toxicity, extensive membrane, stridor. You should suspect, diphtheria. So if you suspect diphtheria, you should treat it immediately. Obtain a swab and culture, but you should treat the patient immediately, because delaying of the diagnosis will result in poor outcome. So what are the principles in the treatment of diphtheria? Number one, diphtheria antitoxin, to neutralize the toxins to prevent the development of polyneuropathy and myocarditis. Antimicrobial therapy, supportive care, including debridement, airway protection, okay? And the most important was in respiratory isolation, because it is an aerosol or airborne disease. So the patient should be nursed in an isolated room, because the disease is infectious. So these are the principles of treatment.
دكتور
Yes.
زين انا شلون اوصل للسيندوممبرين اذا بس اطخه بالتانك دبرزار يصير عندي بليدنج؟
You should not. يعني عادة clinical suspicion. يعني هو clinical bleeding يعني هو مو severe عادة. minor bleeding يصير عادة. اوكي. لكن انت عادة هذا if you confirm، يعني انت اذا عندك شك، بس انت عادة من تلقى هيك manifestation severe extensive، اوكي، والبليدنج عادة will be minor، يعني مو يصير ده severe bleeding، لا تتوقع هذا الشيء، هو minor bleeding، اوكي. لان هذا احنا قلنا السودوممبرين firmly attached to the underlying mucosa. فانت من تدفع السودوممبرين the normal mucosa will be breached as a result of this severe attachment. انا عاده لما اشوفه ما يحتاج اسوي هذا الشيء، يعني very characteristic، من اشوفه مره بعد ما تنساها من diphtheria. اوكي، وعاده بالشتاء نشوفه من مره، صيف very rare يعني عاده because it is airborne disease and transmitted in winter period and the bacteria is usually active in this period يعني عاده. Okay. What about the prognosis? What about the risk factors of death؟ يعني risk factor of death، يعني شو تتوقعوا انها risk factor of death in patient with diphtheria؟
airway obstruction.
Yes, okay, the patient has severe disease and involvement extensive، عنده extensive pseudomembrane، الماوث مالته كلها صار extensive، bull-neck deformity is very marker of poor prognosis. بعد
دكتور مايوكاردايتس.
myocarditis.
yes myocarditis جيد. اوكي، age important مو الايج؟ شو تتوقعون بالنسبه للايج؟
دكتور كل ما يكون اكبر elderly كل ما اخطر.
yes because of waning of immunity. صحيح، age يعني more than 40 عاده احنا نشوف ماني فوق ال 40 this is a marker of poor outcome, so you should be managed early and rapidly. وإذا عندك
دكتور والمفروض الأطفال هنا
شو وقت أطفال يا طفل عادة إذا يا which age will be vulnerable؟
ما أعرف بالضبط which age، بس هو كل شيء يعني يكون صغير بحيث المناعة مالته.
5-year-old, okay, less than 5. So the risk of factor of this in addition to age قلناها bull neck because it indicates severe extensive disease, development of myocarditis. شلون نعرف المريض عنده myocarditis صار يعني شو تتوقعون؟ يعني شو المريض يجي نتوقع المريض عنده myocarditis؟ إذا عندكم أجوبة؟ مدى أسمع طلاب صوتكم شوي مو واضح. شنو العفو؟
دكتور من الاي سي جي اذا نسوي الاي سي جي حيبين.
يعني شو يبين؟ يعني one of the diagnostics ممكن يعني T inversion, ST depression, اوكي heart block، اوكي بعد ممكن يجي arrhythmia ممكن يجي المريض عنده ventricular tachycardia VT. So a patient in the sore throat present to the palpitation you then ECG and you show VT, you should suspect diphtheria myocarditis. or شنو ممكن complete heart block, atrial fibrillations. So these are the manifestation of myocarditis. واضح؟ الايج قلناها especially طبعا الايج يعني more than 40 and especially more than 60 يعني تقريبا مثل التيتانوس اذا الايج more than 60 طبعا هذا مؤرقة. اقل من 5 او اذا اقل من especially اكثر من 6 months يعني very young child اللي هو بعد still ما عنده immunization 6 months very important. يعني هذا عمره مثلا شهرين ثلاثة الطفل صار عنده التيتانوس this is also predict severe disease and poor outcome. طبعا laryngeal movement also and the rapidity of administration of anti-tetanus toxin. يعني كل ما تأخرنا بالanti-tetanus toxin كل ما هاي manifestations مع myocarditis will be more rapid and there will be a risk of death. فنرجع مرة ثانية administration of if you suspect you should immediately give diphtheria antitoxin in addition to other supportive care and respiratory isolation. The most important was rapid administration of diphtheria antitoxin. How vaccination عادة؟ vaccination by شنو؟
هذا دكتور نفسه مال دي تي بي.
Yes, D-TAP. Diphtheria, tetanus, acellular pertussis vaccine. ما راح نسأل المريض ما أخذ ما أخذ. Sometimes الابريفيتد one هو TD بس TD. إذا ما أخذ قبل acellular pertussis vaccine ممكن نعطيه tetanus و diphtheria only and 2 in 1. ممكن تفاصيل أكثر أني كاتب لكم إياها بالمحاضرة إن شاء الله على الإميونايزيشن. طبعا prophylaxis إذا مثلا هو relative مالته عندهم contact with this patient in home very important ممكن نعطيهم شنو either erythromycin or IM penicillin. عادة أما penicillin prophylaxis to the contact patient أو ال persons اللي contact هم asymptomatic you should give him prophylaxis either intramuscular benzyl أو benzathine penicillin should be available or oral erythromycin إذا كانوا allergic للبنسلين. هذا about diphtheria. The last one is anthrax. Short notes about anthrax. As you know, it is also a gram-positive fraud. This is the usual appearance of a gram-positive. عادة يكون لونها purple in color. Gram. This is also a sporulating bacteria. The pathogenesis. We have two forms of this disease, either GI or inhalational anthrax, GI anthrax or inhalational anthrax. The GI one in humans, the GI anthrax following ingestion of contaminated and undercooked meat. Undercooked meat. So the meat will be responsible for this disease if it is contaminated with the spores of bacillus with the anthrax. The other one is inhalational. عادة نشوفهم بالشيب يعني عادة contact with sheep, especially the wool of the sheep. It is contaminated with these spores. واضح؟ So it will cause inhalation, hemorrhagic mediastinitis, and result in respiratory failure. صوتي واضح طلاب؟
دكتور شنو البكتيريا نفسها ثاني؟ Anthrax؟
Yes, anthrax, Bacillus anthracis. This is the usual organism responsible for anthrax. Bacillus anthracis is abbreviated B anthracis. The usual causative organism for anthrax. والديزيز شو اسمه؟ anthrax. The causative organism, this is the gram-positive rot. Bacillus anthracis. واضح؟
دكتور شو اسمه بالعربي هذا انثراكس يعني شنو؟
انت شو تتوقع؟ شو يسموه بالعربي؟ اكو واحد طلاب عنده اسم؟
الجمرة الخبيثة دكتور؟
Yes, very good. يعني الجمرة الخبيثة. اوكي. ليش يسموها جمرة خبيثة؟ Because have characteristic skin finding. بالسكن هاي manifestation of skin. يسموها الجمرة الخبيثة. اوكي. So the main forms is GI and inhalational. There are other forms so in GI or contaminated meat. عادة يصير بالهيستوري إذا مريض ماكل undercooked and contaminated meat, or the inhalation of the spores. The skin. عادة skin هو يسموه باللغة العربية هذا الترم. Skin will be an scar, extensive surrounding edema, is the hallmark of cutaneous anthrax. So a scar due to black necrotic tissue surrounded by edema. So this is what you call in Arabic the جمر الخبيث. Okay, يشوفون black scar. This is the black skin. هذا necrotic area, black one, surrounded by edema. This is another one, but healed. And this is shown in active form. This is the cutaneous anthrax. This is the hemorrhagic mediastinitis. The patient will present with cough, dyspnea, and wide mediastinum. هذا الميدياستينم يعني منصف الصدر يكون widening به صاير. Present with cough, hemoptysis, hypotension, and hypoxemia. And Bacillus anthracis is highly susceptible to a variety of antimicrobial. عادة يعني كتريتمنت antibiotics. This bacteria is not toxin generation, but the disease responsible for due to multiplication of bacteria. So you have to. There are a wide variety of antimicrobials to which Bacillus anthracis is susceptible, including penicillin, chloramphenicol, tetracycline, erythromycin, streptomycin, and fluoroquinolones. But unfortunately, the disease is so severe, and مرات المريض within few hours may die as a result of this fast multiplication of this bacteria. اوكي واضح طلاب بالنسبه للانثراكس؟ ما تعرفون التفاصيل عنه يعني اهم شيء انه عندي انه whether الاورجانيزم responsible the forms عندنا GI عندنا inhalation عندنا skin. اوكي والانتيبايوتيك طبعا شنو الانتيبايوتيك responsible يعني بنسلين كلورامفينيكول تتراسايكلين وهكذا يعني فد شورت نوتس حتى بالمحاضره ما بديكم تفاصيل عنه. إذا عندكم سؤال طلاب؟
دكتور شنو التريتمنت مال ديفثيريا؟
تريتمنت اوف ديفثيريا يلا
يعني انتيبايوتيك قصدي الانتيبايوتيك مالته شنو؟
يس شنو الانتيبايوتكس نرجع مرة ثانية.
دكتور هي بوزيتيف جرام بوزيتيف يعني عندها سيل وول بنسلين.
Very good, very good. So you draw a very good and excellent conclusion. It is a gram-positive bacteria. Okay, so if you take in the pharmacology, the gram-positive have a cell wall. So if you break this cell wall, the bacteria is likely to die. So one of the drugs that act on the penicillin. Okay, you know other antibiotics for diphtheria?
Erythromycin.
If the patient is allergic to penicillin, yes. So the drug of choice is penicillin. The drug of choice is penicillin. If the patient is allergic to penicillin, you may give erythromycin, whether it is oral or IV. Okay, very
أو
good.
ريفامبين.
لا مو ريفامبين عادة هو penicillin. The patient allergic نعطي شنو erythromycin. بس احنا دائما قلنا if you suspect you have to give first of all شنو سوري ديفتيريا انتي توكسين. بعدين نضيف to eradicate the bacteria. يعني هذه البكتيريا if you could not eradicate it طبعا very good debridement of the pseudomembranes, securing of the airway. Okay, the patient may need ممكن ندخل إلى RCU around the severe stridor and edema of the upper airway.
دكتور
وعادة when you give antibiotics also خصوصا الاريثرومايسين. الاريثرومايسين تعرفوه مو bactericidal, it is bacteriostatic. So when you give such antibiotic, it will stop the toxin generation. يعني صحيح the bacteria is not going to die, but it will stop شنو toxin generation. هذا فكرة الاريثرومايسين. أنا خاف واحد يقول يعني no, why we give erythromycin, because it is not bactericidal, it will kill the bacteria, but it will stop the يعني عادة شنو toxin and generation and multiplication of the bacteria. طبعا احنا rifampicin اكو other drugs مثلا clindamycin, okay they are alternatives, but they are not the first line treatment. First line penicillin, second line erythromycin. If neither of them available ممكن ننطي rifampicin. لا سامعين بي مو rifampicin ممكن يعني اوكي as an alternative يعني, but it has no good efficacy in comparison to penicillin, and it is not the first line drug. نعم
دكتور يا هم هاي disease endemic بالعراق؟
Diphtheria, it is present in Iraq. Tetanus present. Anthrax not. It is not present حاليا يعني لحد علمي ماكو فد reported cases يعني by the WHO يعني ماكو عندنا كيسات reported حاليا.
بس الدفتيريا والتيتانوس يعني اندمج موجودة.
yes present. نعم دائما نشوفها هواي يعني مو يعني tetanus and diphtheria.
شكرا دكتور.
عفوا. بعد إذا عندكم سؤال الدفتيريا والتتنس يعني أهم من الأنثراكس طبعا، ركزوا عليهم جدا بالامتحان خصوصا التتنس. أعطيتكم واجب عليه حتى ترجعون على الموضوع تقروا زين. تعرفون كتابكم ديفيدسون يعني عندنا الشابتر مال infectious disease. اوكي
دكتور
دكتور وين الجواب؟
أكثر يعني بس أركز على ديفيدسون ما يحتاج أروح على غير مصادر
تهمك بعد تريد، بس أنا قصدي الكتاب المنهجي هو ديفيدسون. but the science is not limited to one textbook. إذا عندك وقت تريد تطلع اوكي شو كبير. عندنا هارسن يعني هارسن يعني عندي هواي كتب يعني تريدون تتوسعون أكثر، بس أنا قصدي هو كتابكم ديفيدسون. سأراويكم
زين دكتور وين ندز الجواب؟
أنا حسوي لكم فورم جوجل فورم أوكي وأنتم إن شاء الله مثل واجب أكيد كلكم أحسن. هذا عندكم رسالتكم أكو تطلع بعد أكثر. هارسن يعني موجود في التليجرام.
صعب ليش؟ من ديسون كمعلومات
تريد شويه تتوسع بالكلينيكال مانيفستيشن تقرا بس انت ما تقرا كل الكتاب. فيسبوك يعني فد موضوع ما فهمته بديفيدسون ما شارحه زين ممكن ترجع له بهارسن. بس ديفيدسون هو كتاب ريفيو بوك ممكن تطلع على معلومات بصوره عامه عليه. اوكي يعني تركوا universities outside Iraq the undergraduate read Harrison not Davidson. يعني خلي بالك اكو جامعات في خارج العراق هارسن هو it's the box for undergraduate يعني in your year يعني. فهو الساينس is not limited to one book. انت حاليا مطالب محاضره بالاضافه الى ديفيدسون. اذا عندك وقت شكو بها تقدر تطلع اكو other books other than why اكو كورس in infectious diseases in internal medicine etc. اوكي طلاب شكرا على حضوركم، اتمنى لكم الموفقيه ان شاء الله. بس ردت زين العابدين، اين هو زين العابدين؟ السيشن مال
نعم
النيورو.
دكتور نعم.
سيشن النيورو شو وقت راح يصير؟
ان شاء الله باشر دكتور الاربعاء ناخذه بالعشرة الصبح.
باشر بالعشرة ان شاء الله. يلا جود لك. وبالتوفيق. مع السلامة. شكرا لحضوركم.